Hi, I'm Laura Ledford, and this is my sister,
Megan Ledford.
and today we're going to be talking about Sturge-Weber syndrome, which she actually has.
Who and what ages are affected by Sturge-Weber syndrome?
Any age can be affected. Babies are actually born with it. You don't develop it over time. So she was born with it. She was diagnosed at 3 months old after she had received her vaccine. One of the vaccines being the whooping cough vaccine, which induced her seizures that she has. So that's what triggered them to find the diagnosis for Sturge-Weber syndrome.
Is Sturge-Weber passed through families or is it a congenital disease?
No, Sturge-Weber syndrome is not passed through families. It is a congenital disorder that develops within the first trimester of pregnancy.
What are the causes of Sturge-Weber syndrome?
Causes for Sturge-Weber syndrome are
Unknown.
How many babies are born with Sturge-Weber syndrome?
the statistics for babies born with Sturge-Weber syndrome are 1 in 1,000 have a port wine stain, which is also known as a birthmark. It's just a deeper tone birthmark, which is what she has. And 1 in 50,000 babies are born with Sturge-Weber syndrome. Now, out of the babies born with a port wine stain, 8 to 15% of them turn out to have Sturge-Weber syndrome.
What are the most common characteristics of Sturge-Weber syndrome?
The most common characteristics of Sturge-Weber syndrome are glaucoma, seizures, birthmarks, organ problems.
What are some of the complications associated with Sturge-Weber syndrome?
Some of the complications associated with Sturge-Weber syndrome involve heart problems, lung problems, liver problems, mental health problems including mentally handicapped, learning disabilities, paralyzation due to seizures, strokes.
What are the symptoms and is there any treatments?
Symptoms go along with the complications. They can have strokes, heart attacks, they can have problems breathing, lung problems, liver problems, you name it, they may have a problem with that organ. Treatments, there are treatments for glaucoma to help them see better. There are also treatments that can lighten the birthmark, but it can be very painful to them. So we personally in my family, we never had her go through that pain because she's been through so much with the doctors and stuff. But that is an option for some people.
Is there a way to test for Sturge-Weber syndrome?
During pregnancy, there is no way to test for Sturge-Weber syndrome, but after the baby is born, if the doctor suspects that the child may have Sturge-Weber syndrome, they can do full machinery tests, including x-rays, CAT scans, MRIs, an EKG, along with checking for glaucoma, which may be a big sign that a baby has Sturge-Weber syndrome.
Summarize Sturge-Weber syndrome.
Sturge-Weber syndrome is a neurological disorder that affects brain function and most organs in the body, depending on the person and what type of Sturge-Weber syndrome they have. It can also involve glaucoma and a port wine stain covering most to a small portion of the body, depending on that person. Once again, Sturge-Weber syndrome is not life-threatening, but the complications and symptoms that come along with Sturge-Weber syndrome can be life-threatening.